When thinking about offering admission from a risk management perspective, there really are alternatives. It's interesting that patients will often accept the risk of discharge, but they can't really even identify what that risk might be. We suggest that Epic physicians really include patients in the healthcare decision-making overall, but to be very cautious, especially in a complex decision. When a patient is thinking that offer of admission could lead them to believe that either decision could be safe, that of admission or that of discharge. If a patient is resistant to admission, we suggest really that you do not negotiate your decision. It's okay to negotiate care, and what I mean by that is, if it's a chest pain patient and we need an additional set of enzymes, to negotiate staying a couple more hours to try to convince the patient that you need more observation time. If it's a patient who's competent, who's capacitated to make the decision, then clearly if they're not going to follow your recommendation, we suggest that you use the AMA process.
I think physicians mistakenly believe that if they've offered admission to a patient that somehow that either lets them off the hook or that they can document that. We encourage physicians to be clinically decisive and make a recommendation to the patient, either to come in the hospital or it's okay for you to go home with this certain follow-up. But just the act of offering admission, many times we find physicians get talked out of what they know is doing right by either the patient, by their family, or by a colleague. So offering admission might inure a false sense of security when in fact it's really the clinical decision and recommendation that's the physician's responsibility. We actually have found that offering admission to the patient may potentially increase liability for the physician if there's a bad outcome. An example of offering admission to a patient that resulted in an adverse outcome and potential liability for the physician is a common scenario where a patient may arrive to the emergency department with chest pain, may actually have some cardiac risk factors, but the initial workup, let's say the EKG and enzymes, are negative. And at that point in time, the patient who is anxious to go home has a discussion with the physician who agrees, and perhaps against their better judgment, that it's safe for the patient to go home. We've seen case scenarios where those patients have come back to the emergency department sometimes within a few hours in full cardiac arrest. And at that point in time, the liability question for the physician is, who was the best person to make the recommendation to either be admitted to the hospital or to go home? And it appears by offering admission that you let the patient decide. I think you can hear the attorney now. So if I understand what you were saying, you were not able to actually determine whether it would be better for the patient to stay overnight or not. So you decided to let the patient make that decision. Now, from what I understand, this patient works as a teacher's aide. Exactly how is it that you elected to let the patient decide whether or not it was in her best interest to be admitted or not? The difference between offering admission or recommending admission may seem like semantics, but it's really not in the case where there's a potential bad outcome. By offering a patient admission, one can document that, and it speaks to collaboration with the patient. But really, the decision to stay in the hospital or go home is a clinical decision that should come with a firm recommendation. And we see many cases where physicians are potentially talked out of the decision to admit somebody by either the family or the patient's anxious to go home. So our firm recommendation is to make a clinical recommendation either to come into the hospital or to go home with close follow-up and to stick to their guns.